Okay, I officially will call the meeting to order of the Pennsylvania Opioid Trust. This is the public meeting. I would like to say that this meeting of the Opioid Trust has been duly advertised as a public meeting in accordance with the Sunshine Act. It is therefore open to members of the public as observers. Participation in this meeting is limited to trustees and those the trustees have invited in advance to take part. Meeting is being recorded and minutes from this meeting will be available on the trust website after they're approved by the Board of Trustees. The executive session was held today immediately prior to this public meeting for the purpose of receiving legal updates, litigation advice, and that is very typical of what we have done before all of our public meetings. So with that, either Ashley, would you like to take roll or Bree?
Tamar Alexander.
Good morning, everyone present.
Secretary Latika Davis Jones.
Present.
Commissioner Patrick Fabian.
Present.
Stuart Fisk.
Present.
Representative Jamie Fleck. Oh, okay, sorry. Thank you. Representative Danielle Friel Otten.
Present.
Kay Madden. Commissioner Robert Postal.
Present.
Senator Dawn Kiefer.
Here.
Senator Christine Tartaglione. Chair Tom Van Kirk.
Present. So we do have a quorum established and we will proceed with the meeting. I would like to, as the first matter of business, welcome two new members to the trust, and will put us near a full complement of our 13 trustees. First, Commissioner Pat Fabian from the Northwest part of the state is replacing Steve Jasper. We certainly would like to thank Steve for his work during the time that he was on the board for the last 3 years. Commissioner Fabian currently serves as the Armstrong County Commissioner, a role he's held since 2016. Commissioner, he served as the Manor Township Supervisor, and he's also spent 15 years as an outpatient and family therapist with the Family Counseling Center of Armstrong County. So he comes well qualified with credentials, and we welcome you to the board of trustees. Secondly, we've received notification from Senator Ward that that Senator Rothman has resigned and is no longer going to be a part of the trust board. The Republican Senate caucus, of course, has one appointee, and they have named Senator Dawn Kiefer as his replacement. As you heard, she is on the phone today. This was effective on Tuesday, so we don't expect Pat, either you or Dawn, to be totally up to speed on everything we do. We'll try to pass on any inside information that we can as we go along. But Senator Kiefer was first elected to the Pennsylvania House of Representatives in 2017, representing the 92nd Legislative District in Northern York County. She served in the House until 2024 when she was in the Pennsylvania Senate, and she serves part of Cumberland County and York counties in the 31st District. So we welcome you to the board, Senator, and happy to have you with us.
Thank you.
I'd like to move on to the approval of the minutes. The minutes were in your packet that were distributed. I can have a motion for the approval of the minutes of the June 5th, 2025 meeting of the public meeting of the Board of Trustees. Kevin moved. Second.
Fleck.
Any discussion? All in favor, please say aye.
Aye.
Aye. Next, we are going to move on to an update from the Office of the Attorney General. Neil, are you on the phone to give us an update on the Purdue Sackler settlement?
I am, Tom, and Thank you and good morning to all. There are two pending proposed settlements that are or very shortly will be out to the political subdivisions for their consideration and approval as to joining those settlements. The first involves Purdue Pharma and the Sackler family. Those materials have been distributed to the political subdivisions and are under their consideration now. We are happy to, entertain questions as this process goes on. If questions arise, the deadline for the decision to participate in the Purdue Sackler settlement or not is September 30th. After that date, there will be a variety of legal niceties that will have to take place and be completed before that settlement, if approved, before that settlement can be formally approved by both a bankruptcy court and likely Commonwealth Court of Pennsylvania. So that process will go on after September 30th. But the decision-making time for the political subdivisions will be over on that date. Then it'll just be lawyers addressing issues. So that settlement would likely, if approved, would not become effective until next year, sometime in early to mid 2026. The second proposed opioid settlement, which is completely separate and distinct from the Purdue Sackler settlement, is a much smaller monetary settlement with 8 opioid manufacturing companies. That packet is about to be distributed to Pennsylvania's political subdivisions for their consideration, hopefully simultaneously as they entertain the Purdue Sackler settlement. The deadline for what we're calling the smaller manufacturing settlement is October 7th for the subdivisions to consider their participation in that settlement. And then similarly, there will be legal niceties of a less complicated nature involving the small manufacturer opioid settlement. And so hopefully that settlement, if approved, would become effective sooner than the Purdue Sackler settlement. So that, Chairman, is sort of the state of play currently with the pending proposed opioid settlements.
You say that it might be sooner than the Sackler settlement in the case of the 8 manufacturers. Do you anticipate it will be completed in 2025 or will it be part of 2026 distributions?
I believe the current thinking is that too would be part of 2026.
We just got a sigh of relief from Lisa Ritter, our accountant.
Yeah. Yeah, so that's my current understanding.
Okay, good. Thank you.
Thank you.
Anybody questions on Neil while he's on the phone?
Do we have any tentative amounts? We think they may be.
Do you have the tentative amounts, Neil?
We do, unfortunately, and I have to apologize. They are not in front of me. As the group may be aware, our office experienced a cyber incident, and we are working to remedy that. So I have to apologize to the group. I do not have those materials currently in front of me. I can say back of the envelope, the Purdue Sackler settlement, as I recall, is in the multiple billions, while the opioid manufacturer settlement, again, with some of the smaller companies that were involved, is in the approximately around 700 million, and that's nationally. That is the entire settlement amount to be distributed nationally. So Pennsylvania would be entitled to a share of that amount. So you can see that the two settlements are of significantly different values. But I apologize that I can't give exact numbers this morning.
Thank you.
Thank you.
I recall though, Neil, if you still on, well, we lost them. As I do recall, when they are finalized, the bulk of the first year money that is going to be paid by Purdue Sackler is going to fees, attorney's fees, et cetera. And the full amount that Pennsylvania will get will not be kicking in until probably until 2027. So just so people can use that for planning purposes.
This is Senator Kiefer. Were both of those cases nationally or just the one with the 8
I'm still
pharmaceutical
here.
companies?
Thank you, Senator. They were both. They are both national settlements. So they are being considered now from coast to coast by political subdivisions throughout the country and in our territories.
I assume, Neil, that it's much the same as the other settlements that were entered into. The more counties that sign on and or litigating subdivisions that sign on, the higher amount of money that Pennsylvania gets. Is that correct?
Yes, the incentive system and the process is what is now familiar to the political subdivisions. And you're right, Tom, that's exactly true. There is a strong incentive for subdivision participation. If very high levels are achieved, the Commonwealth and the subdivisions receive the maximum amount under the settlements allotted to Pennsylvania. If participation by subdivisions is not sufficient to meet certain thresholds, then
Correct.
the amount distributed to PA goes down.
For everybody's information, Pennsylvania as a whole punches somewhat above its weight in getting funds because of the way it's being distributed nationally. We had higher instances of opioid than our population would indicate, but so we do punch heavy, and thank goodness we hope that the situation will be the same with these settlements as were with the initial settlements that were entered into in 2022, that being that all 67 counties participated and most of the litigating subdivisions, well, all litigating subdivisions, with the exception of Philadelphia and Allegheny County DAs participated. So that's why the amounts have been as high as they have been thus far.
Mr. Chair, if I may, I have a question. We just received an unexpected email requiring action from the National Opioid to open a portal. We were not expecting that's something new, and it came as a second notice. It's the first one we got, but it said second notice. So I don't know if that was standard or someone could speak to that.
Neil, did you hear that question?
I did. There is a company called Rubris that is handling the management, distribution, and collection of participation forms. So that would have been received from them. I certainly invite you to reach out. I'm happy to answer in a more detailed way if offline, and would be happy to hear from you just to clarify if necessary.
Thank you. It actually came from a company called Brown Group.
Okay, that's, yep, my apologies. They too are a administrative firm that is handling distribution of settlement funds from the national level to the state level, to the Pennsylvania Opioid Trust. It's an involved process, but yes, Brown Greer is a legitimate and very involved vendor here.
Thank you.
Other questions of Neil? Hearing none, we'll move on to the next agenda item, which is going to be a presentation by Penn State regarding the opioid settlement data website that they, in conjunction with Pitt and Temple, created, which should be a great benefit to the public and improve greatly the transparency of where the monies are being spent, what type of items they are being spent on. But I will let Dennis do that. Just by way of background, Penn State and Dennis were involved initially, even before the settlements were entered into, when we were meeting as a group, not the opioid trust, this was pre-trust. And it was being determined how the money was going to be apportioned among the counties and litigating subdivisions. As you know, it's not done strictly by population, it was done by opioid deaths. It depended when the opioid deaths took place. So there was quite a bit of back and forth among all of the counties as to what monies were going to be received. That was all signed off on and has been a part of every settlement since. At a very early stage of the trust existence, we knew we needed to have somebody to collect data for us and create the framework by which the counties could submit data so that we could do our job of seeing whether or not the programs that they were spending the money on were in fact complied with Exhibit E of those overall settlement agreements. We thought it very wise to engage somebody that already knew a lot of what was going on. And we turned to Dennis and Penn State. We did ask that they include the other two large state research universities, Temple and Pitt, in it. So it is a consortium of those three that have been that created and send out all of these questionnaires that the counties get, asking for details on the programs that you are spending money on, that you've committed to spend money on, what has been spent so far, and as many details as possible. They have used the data, much of the data that was created, which belongs to the trust, to create an independent website, which Dennis is now going to describe. Dennis?
Yeah, thank you, Tom. That's a basically great introduction, and so I will talk about that, and then I'll talk about the fourth reporting period, which is in process now. So as Tom mentioned, our research consortium, ourselves at Penn State, partners at Pitt and Temple, have been hard at work for quite a bit of time to produce this website, again, which we have developed and are responsible for, using the data, as Tom mentioned, that is collected by the trust and with permission from the trust to use that data. The website went live publicly on Monday, August 11th, so about a week and a half ago. And since then, significant broadcast and print media coverage informing the public about the website. And I think there is more to come. I already have some additional media requests and others. And generally, when reporters at least speak with me, and they're probably speaking with others as well, and hopefully people in local communities, but when I've spoken with them, they typically just want a little bit of background on the settlement writ large nationally and for Pennsylvania, and then ultimately, what this website can do to provide folks. And so I'm certainly have been happy and will continue to be happy to entertain those media requests just for purposes of getting the word out to the public. The website that is live includes data that has been approved by the trust over 3 reporting periods, including the last reporting period with an end date of 12/31/2024. Of course, those reports were due March 15th, 2025. And so the only information that's included on the website are expenditures on remediation programs that have been approved by the trust through its process. Anything that's still pending or still under consideration, including, for example, some things that the meeting today will be discussing, the trust will be discussing, are not included. But if and once those are approved, we will update the site with that information, and that's how we chose to structure it, so that we're not, reporting things that have not gone through the full trust due diligence and process. I'm happy to say that counties litigating subdivisions as well as trustees were given advance review and the opportunity to take a look at the website, how their information would be displayed. We felt that that was essential. We didn't want anybody to be blindsided by media requests or others when this came out. And while we didn't get 100% feedback from all 67 counties or the many other litigating entities, we got very significant feedback. and comments. And I'm also pleased to say that the comments during that review period were quite positive. Many counties and litigating subdivisions thanking us for producing this, indicating that it's going to be helpful to them. And as I'll mention, well, I'll mention it now. We've heard in a number of venues that those receiving funds have found the website useful for being able to understand how others, aside from themselves, are spending their money, what types of programs. It creates a little bit of a network or a conduit to be able to reach out to another county, another litigating subdivision to say, hey, can you tell me about, this program that you have? How's it going? Who have you contracted with? Possibly even sharing an RFP or contract language or other things. And so the creation of that informal network, we think, in addition to just public transparency, is valuable. I do feel compelled to sort of mention, and this is from my perspective as I hope, an objective, independent third party, that this, I think, really positions Pennsylvania nationally as the model in terms of line item transparency on how every dollar that has been spent is being spent, and details on those programs. We've looked at every state, and sometimes websites change, so we may not be entirely up to speed. But based on our review and continued review, I really don't know of any other state in the union that is receiving settlement funds that has this level of public detail and transparency down to the light item, down to the political subdivision that has made decisions on how to spend that money. And so, I just want to commend the Commonwealth writ large and everybody involved. And there are many people that have been involved, the trust, of course, but also AG's office and, the counties themselves, litigating subdivisions, the public. I know there's, from my perspective, been some criticism of lack of transparency, but, I know we've been building towards this transparency all along. And I think what some don't realize is it takes time to be transparent and to do it in a way that is at a level that multiple audiences can understand the information and understand the data. That doesn't happen overnight. There's also a lag, I think, as most people know, within which this data is reporting. Well, some people might say it's about time. We've heard from many others that, I think the evidence relative to other states is Pennsylvania's out front. I should say, for those on the meeting, the URL for the website, which anybody can access now, is www.paopioidsettlementdata.org. So paopioidsettlementdata.org, all one word. If you were to do a Google search, it should come up pretty prominent towards the top of the list. And I don't know if the POMAAT website has a link to that yet, but I do think they're planning on doing that, and maybe they can make sure that happens. But that is the URL for the website. I will say that our team continues to be involved and is now involved in summary analytics. One of the things, and the reason this took time is I think for public display, the reporting now includes program categories in categories, I think, that are in addition to what the trust requires, of course, for its reporting in compliance with Exhibit E. We have programs that match to categories that are understandable for the audiences for the website. So treatment of various sorts, prevention, harm reduction, research, education, training, and also for populations, youth and school-aged individuals, justice-involved individuals, first responders or healthcare personnel or others. And so, that in the feedback we got was thanking us for that, because while Exhibit E remains and certainly is important for the trust process and the national settlement process, that document is not going to be so easy for many audiences to understand. And so all of this is available in both of those formats. The last thing I'll say is, well, we are sort of in the process analytically of really doing summaries and understanding, sort of which of the categories and populations across the state where these monies have been spent or committed. And we have had a number of suggested changes to the website to further enhance it. So I view what we've gone public with now as version 1, and we're currently working on version 2. Version 2 will include some additional sort features and other ways to sort of query the database via the website tool to be able to get information that one wants. There's already some of that. You can jump to county or litigating subdivision. You can see line item detail and descriptions of remediation programs, but there are further enhancements that we're looking to make in version 2. And I suspect version 2 will probably go live sometime early in 2026 after the round 4 data would be included. And so with that, I'll briefly transition to mentioning that because we're involved in data collection, as Tom said, in creating the tool, securing the data, the 4th reporting period is underway. Links have been sent out to all required counties and litigating subdivisions who need to report. The due date for those reports is September 15th of 2025. That is to cover the period of January 1st, 2025 to December 30th, 2025 in terms of remediation programs, actual expenditures, and commitments, just as has been done in prior periods. The trust will review that information at its in its work groups and its next meetings. My understanding is the next public meeting, I believe, is late November or early December. And again, once anything has been approved by the trust, we will incorporate that into revisions to the website. So this is a living website that will be updated as trust decisions and approvals are made so that we can keep this current for the various audiences. So with that, Tom, I'll end, and if there are any questions, happy to take them, but that's my update.
Does anybody have any questions? I would just like to add that there is going to be a link that should be appearing shortly on the trust website to allow you to link into the Penn State website that Dennis referenced. And also, I'd like to make the comment that early on, when we were discussing this generally, that the bulk of this money should go to the counties because each county suffers different problems related to the opioid crisis. What happens in Fayette County may be different from what happens in Butler County, may be different from Philadelphia. So that we wanted the counties to get the bulk of the money and to make the spending decisions. It is only up to us to then review how the money was spent in order to see if it is in compliance with Exhibit E. The one thing we've seen over the first couple of years is the counties really would like to know what each other are doing and have a mechanism for doing that so that one can learn from the other. If County A has developed a program for reaching out to parents that are welcoming back opioid victims and trying to get them back into the family. If County A has developed a program that does that, we think that counties ought to also be able to take advantage of that if they want to do it. So I think the biggest value of this tool is going to be for the counties to learn from each other and be able to see what has worked and what hasn't worked in different areas of the Commonwealth. With that, are there any other questions that people would like to ask of Dennis? Hearing none, Dennis, thank you very much, and as always for your continued good work and your colleagues at Temple and Pitt. We appreciate all the work you've done for us, and I know it is a considerable amount of work. Okay, we're now going to move on to the next item on the agenda, which is the programs that were reported by the participating subdivisions on March 17th of 2025. According to the court order that established the trust and set up the fact that money was going to be distributed, it is required by that trust order that the participating subdivisions shall submit a report to the Board of Trustees by March 15th showing how they spent the opioid settlement funds and the amount of opioid settlement funds received but not spent. Because March 15th this year fell on a Saturday, we did modify the due date, and the reports were filed by March 17th of 2025. Majority of all of the 67 counties and the vast majority of the litigating subdivisions did submit their reports by that March 17th date. Although that happened, it did turn out that there are 2 litigating subdivisions. They were not required to report until this year, so they didn't have the advantage of doing this in 2024 and 23. But the only litigating subdivisions not to submit their reports were Mahoning Township and Aliquippa City. At our June 5th, 2025 meeting, the board passed a resolution which put those 2 litigating subdivisions on notice that their failure to file and require that within 3 months, each must submit a report. To date, neither of them have yet submitted the report. If such a report is not submitted by either Mahoning County or Allegheny, if it's not submitted, the board may take further disciplinary actions up to and including withholding distributions to those subdivisions, which the Commonwealth Court Order gives us the right to do. I would note, because the question has been asked of me by several municipalities, if the money is not spent, or if we have deemed them not to be compliant, and the money is forfeited by any litigating subdivision or indeed by any county, the money does not go back into the overall pot. The money goes to the Commonwealth of Pennsylvania for them to use. And as you all know, the Commonwealth, their 15% of the monies thus far has been distributed to DDAP, and DDAP under the great leadership of Secretary David Jones has made sure that the Commonwealth has distributed its funds. So I think it's appropriate that money would revert to them. I would say also at the meeting of June 5th, the board, based on recommendations from the working groups, acted upon a majority of the programs that were submitted to us in March. Consistent, however, with prior practices, several of the programs were characterized as still under consideration. As I think all of you are aware, the way we approach this is to either deem them to be compliant with Exhibit E, be not compliant, in which case it was not approved, and people can appeal it to the Dispute Resolution Committee or to the directly to the Commonwealth Court. But we do want further information on many of it, and we've done this at every meeting in the past, and we did it at June 5th. So therefore, all of the additional information relating to the programs listed as still under consideration were reviewed by working groups after the additional information was submitted. The working groups met several times each during July and August of 2025 to review the additional information that was submitted, which in the case of each working group constituted a binder that many times consisted of more than 1,500 pages of additional information. So it's quite an undertaking that the working groups do undertake in order to fulfill their responsibility. Their responsibility is to reach a recommendation and make a recommendation to the entire board, which they are prepared to do today and which we will act on. We'll now review the programs submitted and we will break out. We will have a spreadsheet that shows what those programs are that the working groups considered, and they will make their recommendation. And after a number of recommendations have been made, we will vote on it. So we'll probably have 7 or 8 different votes as to whether we approve or view the programs to be non-compliant. So with that, we can get started. And I'm having trouble reading the screen. I have to tell you. So I didn't think I would be alone on it. Let me, what was in the, this was all submitted to the trustees in a packet, before the meeting, but the first one that I see is Bedford County, which was reviewed by working group number 2. So, Stuart Fisk is the, chair of that, working group. Would you please report on Bedford County?
For Bedford County, program number 3. Submitted by Bedford County Probation to establish a problem-solving court. No dollars were spent, $33,103.91 were committed, and this is still under consideration.
Thank you. Any questions? That will move us on to Blair County, which was reviewed by working group number 1, Kevin Booth.
Thank you, Chair. Blair County, program number 5, Central PA Behavioral Health Collaborative Contingency Management Services. They had a total expenditure of $524,560.84, and it is recommended for approval.
Thank you. Any questions concerning that program? That will move us on.
Hello, can you guys hear me? I do, I just to clarify, and I'm sorry, I'm new and I was trying, like you said, I was appointed on Tuesday, so try and get up to speed on all of this. And just confirming, so this was 524,000, this was all for management services?
Let me pull this up. It has a description in your file that was given to you. Give me 1 second. Blair County awarded Blair County Health Choices opioid settlement money to implement contingency management and evidence-based program in Blair County. The proposal provided the commissioners included subcontracting with Dymacare to provide a digital platform to increase accountability of the members to provide timely rewards to them. That's the gist of the program, but I don't have all the details other than that.
Yeah, that's what I was reading as well, it just sounded like it was administration, not necessarily program. All right, thank you.
Yeah, and the first part of your question, yes, the entire 524 was spent and not just committed. That will move us on to Bucks. And that Bucks County was program number 47. And that has been withdrawn by Bucks County, so that it was not considered by any working group. That will move us to Butler County, and that was working group number 3. So Shay Madden will report on that.
Butler County program number 10, Butler County Community College, personal empowerment training. Total spent was $26,000. We recommend approval.
Okay, any questions? That moves us to Carbon County, their program number 3, reviewed by working group number 1. Back to you, Kevin.
Sure. Carbon County, Carbon Monroe Pipe Drug and Alcohol Peer Recovery Support Services. They have expended $25,000 for peer recovery services to decrease chances of reuse of opioids, and it was recommended for approval.
Thank you. Any questions? The Crawford County, their program number 9, reviewed by group number 3. Shay.
Crawford County program number 9, Crawford County Drug and Alcohol Center of Excellence program. Amount spent was $42,760.26. We recommended approval.
Sorry, I missed Clarion County. Sorry about that. The print really is pretty small. So Clarion County, their program number 5, and it was reviewed by working group number 2, Stuart.
Yeah, program number 5, Clarion County Human Services. For mental health student assistant program liaisons, $58,287.14. That recommend.
Any questions? And that will move us on to Delaware County, working group number 2, Stuart. You were going to discuss both their program number 37 and program number 42.
Delaware County program number 37, the Delaware County Health Department. This is harm reduction, total spend was $175,000, 75,837.05. We recommend approval. Delaware County number 32. Community recovery event put on by MPV Recovery. Total spend was $13,037.98. Recommend approval.
Okay, I would note with Delaware County number 37, part of this was spent on Narcan and Narcan distribution, clearly an allowable use under Exhibit E. But we want to remind everybody and each county that there is a significant amount of free naloxone that is available from the state, that they don't have to spend their money and they can put it on other purposes, and would ask them to avail themselves of what is available from the state. So with that, we are going to vote on the ones that we have already discussed, which will be Blair, Bucks, Butler, Carbon, Clarion, Crawford, and Delaware County. I would like a motion that resolve the Board of Trustees of the Trust, based on the recommendations of the working groups that met and reviewed the follow-up reports from the counties, hereby approves the following programs as compliant with the applicable terms of the settlement agreement as set forth in Exhibit E, and which was incorporated into the Commonwealth County Program number 5, Butler County Program number 10, Carbon County Program number 3, Clarion County Program number 5, Crawford County Program number 9, and Delaware County Programs number 37 and 42. So can I have a motion to that effect?
I'll move the motion. This is postal.
Okay, second? Second by the secretary. Any discussion?
This my extension from Butler.
Okay, Kevin Boozle is not going to vote with regard to Butler. All those in favor of the motion, please say
Aye. Aye.
opposed. Any abstentions? Other than what has already been noted as far as Kevin abstaining from Butler County. Okay, motion passes. That will move us on now to Erie County. Their program number 19, reviewed by working group number 2. So Stuart Fisk.
Erie County Program number 19, submitted by the SCA, treatment services for Erie County residents, including MAT. Total committed was $300,000, and we recommend it.
Okay, any discussion? Forest County, their program number 5.
Forest County Program number 5, Forest Area School District for school-based programming. The amount spent was $2,840. We recommend.
Any questions? Franklin County, number 17, reviewed by working group number 2. So Stuart.
Franklin County number 17, Healthy Community Partnership for Opioid Education Prevention Coordinator. Total committed was $186,000. Recommended.
Any questions? Greene County, program number 1, reviewed by working group number 2. Stuart, you're still on.
Greene County, program number 1, Geyser Center, for substance use disorder treatment, $175,427.86 was spent, and we recommend approval.
Thank you. Next is Indiana County, working group number, their program number 5, and that is working group number 1. Yep.
Indiana County Program number 5, Indiana Healthcare Physician Services Mobile Unit, expended $200,000. It is recommended for.
Thank you. Any questions? Moves us on to Lackawanna County, which has programs number 1, 3, 4, 5, 6, and 7. And that was reviewed by working group number 2. Stuart.
Lackawanna County, program number 1, drug and alcohol treatment services for Lackawanna County prison groups. Total spent was $31,200. Recommend approval. Gonna run through all these.
Yes, well, yes, and we can ask questions as to any one of them after after you've gone over all, 7 programs.
Thank you.
Six programs, excuse me.
Lackawanna County, program number 3, the Recovery Bank for Peer Recovery Center, $78,000 was spent. Recommend approval. Lackawanna County number 4, Recovery Rises Foundation for Female Licensed Recovery House, $65,000 was spent. Recommend approval. Lackawanna County number 5, Fellowship House, Male Licensed Recovery House, $65,500 spent. Recommend approval. Lackawanna County number 6, the Right Center, Women's Treatment Expansion, $65,354 was spent. We recommend approval. Lackawanna County number 7, Outreach, Women Prison Reentry Program, $115,000, 687. $8,687 was spent and we recommend approval.
Hey, any questions? It's on to Lancaster County, their program number 10. Once again, Stuart.
Lancaster County, program number 10, Compass Mark. Total spent was $10,946.20. Total committed was $109,053.80, and we recommend.
It's on Lawrence County. With that, I'd like to call for a vote on all the counties we just,
We need to do.
sorry, Lancaster, excuse me,
Lawrence.
Lawrence County, excuse me. Number 3, Shay.
Lawrence County Program number 15, the Children's Advocacy Center, Ministry of Risk. Amount committed is $14,000. We recommend approval.
Thank you. Any questions about the Lawrence? Okay, with that, we will undertake a review of all of the vote on all of the ones that we've just reviewed. I'd like to ask for a resolution to the effect that resolve the Board of Trustees of the Trust, based on recommendations of the working groups that met and reviewed the follow-up reports from the counties, hereby approves following programs as compliant with settlement terms as set forth in Exhibit E. That being Erie County Program number 19, Forest County Program number 5, Franklin County Program number 17, Greene County Program number 1, Indiana County Program number 5, Lackawanna County Programs 1 and 3 through 7, Lancaster County Program number 10, Lawrence County Program number 15. Can I have a motion to that effect?
So
Kevin Boozle moved. Second,
Second.
and second. All those in favor, please say aye.
Aye.
Opposed? Motion passes. That will move us on to, Luzerne County. Luzerne County, program number 7, working group number 2, Stuart.
Luzerne County number 7 from the Luzerne, Wyoming Single County Authority for Volunteers in America. Total committed was $121,800.
Thank you. Luzerne County number 8.
Also submitted by the Single County Authority from Luzerne and Wyoming counties, Luzerne County Community College, All One Recovery Educational Institute. Total of $250,000 was committed, and we recommend it.
Thank you. Any questions concerning the 2 programs from Luzerne County? This would be a good time for me to note that it really is helpful for the counties to work with their single county authorities, make themselves familiar with the work done, because the single county authority has a great deal of expertise in this area, can really help the counties work toward a solution and how to spend the money. And as you'll notice from the ones that do go through the single county authorities, typically we get enough information to fulfill it. So just a plug for the single county authorities and for counties that are wondering how to make use of money. They are a good resource for as to how to spend the money. That will move us on to Lycoming County, program number 2. And that is Kevin's.
Okay, Mr. Chair, I'll run through 3 of them. So program number 2, West Branch Drug and Alcohol on-site medical care. They expended $17,110. It is recommended for approval. Lycoming County program number 3, West Branch Drug and Alcohol for transportation. They've expended $4,468.17 for things like bus passes and so on, and it is also recommended for approval. Along with Lycoming program number 4, West Branch Drug and Alcohol client housing. They have expended $191,971.89 for stable housing. It is also recommended.
Thank you. Any questions concerning Lycoming County?
I just note that West Branch Drug and Alcohol is the single county authority for Lycoming.
Yes. If everybody could hear that, West Branch is the single county authority and once again, the value of taking these things through the single county authority. And by the way, that's particularly true also based upon a conversation I just recently had with an attorney that represented a number of municipalities who have not been required to spend the money yet, but was asking, how do we spend the money? What can we spend the money on? We don't have any use for the money. I recommended to them that they turn to the single county authority and indeed to the county of which they are a municipality, because they can coordinate and cooperate with other municipalities. They can cooperate with the counties. That will be many programs that they can turn to, but we do recognize that now that the municipalities and smaller litigating subdivisions are involved, they are going to be looking for ideas as to how to properly spend the money, not only in compliance with Exhibit E, but for the good of all of their constituents. So I just wanted to point that out. Now we're going to move on to a very lengthy one, Montgomery County. We had sent a lot. Montgomery, it starts with Montgomery program number 16. This was working group number 3. Check.
Okay, Montgomery County program number 16 should be noted, it was withdrawn. So there was no consideration there. Montgomery County program number 17, Teach One, Feed One. From the Teach One, Feed One Peer Support Network, they have committed an amount of $85,792. We would recommend approval. Montgomery County program number 20, Montgomery County Department of Public Safety Emergency Medical Overdose Surveillance System. They have committed an amount of $132,341. We would recommend approval. Montgomery County program number 21, Maternity Care Coalition for the Momobile Rapid Engagement. They have committed an amount of $107,488. We recommend approval. Montgomery County program number 23, the Council of Southeast Pennsylvania. Through ProAct Recovery Connections, support people in treatment and recovery. They have committed an amount of $20,000. We would recommend approval. Through the ProAct Reaching Out, they have committed an amount of $10,000. We would recommend approval. Montgomery County program number 32, Center for Forensic Science Research and Education, qualitative and quantitative chemical research on public health risks and harm reduction opportunities within illicit drug markets and materials. They have committed $65,285. We would recommend approval. Montgomery County program number 41, Montgomery County Department of Health and Human Services, Office of Housing and Community Development, for a master leasing program for the unhoused with opioid use disorder. They have committed an amount of $393,457.50. We recommend approval. Montgomery County Program number 42, Verde Environmental Technologies, Path to Prevention. They've committed $463,206.24. We recommend approval. And Montgomery County Program number 43, the Poison Control Center at CHOP, Montgomery County Home Drug Safety Toolkit Training Program. They've committed an amount of $19,040. We recommend approval.
Word about Montgomery County and a couple of their programs, if I may. Montgomery County, as you can see, had a number of programs. We did not think that when they made their initial submissions, which on March 17th of this year, that were reviewed by the board on June 5th, many programs were lacking detail and most of them were sent back for reconsideration. Two of them were disallowed and deemed non-compliant. And both of those programs, which are Montgomery programs number 31 and 32, were submitted to the Dispute Resolution Committee. That information that was filed with the Dispute Resolution Committee clarified those programs much the same as the clarifications that they gave with regard to the numerous other programs that you just heard about. The Dispute Resolution Committee felt that they would be compliant based upon the new information, but because the Dispute Resolution Committee consists of 7 of us, the trust is 13 people, of course. There were only 5 people present at the Dispute Resolution Committee. We felt it would be a better course rather than the Dispute Resolution Committee just automatically approving it and giving the go-ahead, that it would come back to the full board. So included in what Shay just went over were programs number 31 and 32, and we are asking for the consideration of the full board of those. And as you can see, Shay was recommending approval. Any questions on Montgomery County? That will move us on to Northumberland County. Group number 2, Stuart.
Bear with me, you got a long stretch of me coming up. Northumberland County, program number 3 from Gaudenzia, an MAT mobile unit. Total spent has been $118,109.94. The total committed was $44,246 and no cents, and we recommend approval. Northumberland County number 4, WNEP, local television advertisement. Total spent was $40,000 and we recommend approval.
Okay, any questions concerning Northumberland County? Moves on to Schuylkill County, and Stuart, you're right, once again.
Schuylkill County number 5, Schuylkill County Drug and Alcohol program, base for counseling in the local prison. Total spent was $57,290. Total committed was $975,620, and we recommend approval.
Okay, and Susquehanna County.
Susquehanna County number 6, NEPA Community Health Center.
Susquehanna 5.
Oh, I'm sorry, there's a little skinny line there, that's Susquehanna County number 5, Tree Hab. It's a Tree Hab school-based program. Total spent was $80,015.15. We recommend approval. And then again, number 6, NEPA Community Health Center. Total spent was $30,000. We recommend.
Thank you. And you're right, Stuart, you do have a number coming up, but we are going to take a break here and vote on the ones that so you can take a break. Okay. We will deal with the ones that we have just been discussing. And it is resolution number 3, which is the Luzerne, Lycoming, Montgomery, Northumberland, Schuylkill, and Susquehanna County. I'd like a motion that resolve the Board of Trustees of the Trust, based on the recommendations of the working group that met and reviewed the follow-up reports from the counties, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E. Luzerne County Program number 7 and 8, Lycoming County Programs number 2 and 4, Montgomery County Program number 17, 20 and 21, 23, 31 and 32, and 41 through 43. Northumberland County Program number 3 and 4, Schuylkill County Program number 5, Susquehanna County Programs number 5 and 6. I have a motion that they be approved.
So moved, Kevin.
Kevin Boozle, move. For a second, Stuart
Second,
seconded.
Tamar Alexander.
Thank you. We'll have tomorrow's a second. Any questions?
Yeah, this is Chairman, this is Rep Flick. I'll abstain from the Lycoming county ones.
Okay, thank you.
Same for.
Thank you.
Mr. Chairman, I would like to abstain. I just have not been able to get through all of this to vote yes in good conscience.
Okay. Next, and we have the abstentions that are, so can we have a vote on the resolution? All those in favor, please say aye.
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 And any other abstentions other than the ones that we just noted? Okay, that will move us on to Warren County and Stuart.
Warren County Program number 2, Family Services of Warren County for Family Services and Recovery Support Program, total spent $25,000. Recommend approval.
Okay. Washington County, there's a number for Washington County. So you will be on for a long time with this one, Stuart, but it's Washington County is work group number 2. Stuart.
Okay, Washington County Program number 2, Washington County Human Services for Club Serenity, total spent $15,000. Recommend approval. Washington County Program number 3, Washington County Human Services DARE program, total spent $35,000. Recommend approval. Washington County Program number 4, Washington County Human Services Domestic Violence Services of Southwest Pennsylvania, total spent $59,625. Recommend approval. Washington County Program number 5, Washington County Human Services and Nicholsworth Consulting and Coaching, total spent $75,000. Recommend approval. Washington County number 6, Harmony Life Center, $121,950 was spent. Recommend approval. Unless I say otherwise, these are all submitted by Washington County Human Services. Washington County Program number 7, MedMark, total spent $36,556. Recommend approval. Washington County number 8, Peters Township Police Department, $42,500 spent. Recommend approval. Washington County number 9.
Stuart, do you want to clarify? that
Yes.
that's For a social worker, please.
Yes, I'm sorry, yeah, so, yeah. Most of you know that, the trust, is not supporting law enforcement, expenditures. This was for a social worker to work with the police department, which we felt was, consistent with Exhibit E recommended. Questions on that? Right, Washington County number 9, Resurrection Power, Washington, Pennsylvania, total spent $34,573. Recommend approval. Washington County number 10, Road to Recovery Symposium, total spent $5,660.14. Total committed $4,339.86. Washington County number 11.
Recommend approval.
I'm sorry, recommend approval. Washington County number 11, Serenity Farms, $250,000 spent. Recommend approval. Washington County number 12, SPHS Mon Valley, $62,000 was spent. Recommend approval. Washington County number 13, SPHS Washington, $62,000 spent, recommend approval. Washington County number 14, the Turning Point, $75,000 spent, recommend approval. Washington County number 15, WC Aging Services, $20,000 spent, recommend approval. Washington County number 17, Opioid Recovery House, Amelia, $65,000 spent, recommend approval. Washington County number 18, DHS Certified Recovery Specialist, $62,000 spent, recommend approval. Washington County number 19, DHS Facility Compliance, $50,000 spent, we recommend approval. Washington County number 20, DHS Washington County Police Social Worker, $42,500, we recommend approval. Washington County number 21, DHS Street Outreach Coordinator, $16,800 spent, recommend approval. Washington County DHS Identity Documentation, $2,500 spent, recommend approval. Washington County number 23, Washington County District Attorney, $30,000 spent, total committed was $20,000. We recommend approval. Just to note that although this program is called Washington County District Attorney, it does not provide funding for a district attorney directly, but rather for mini grants administered through the Washington County District Attorney's Office. And complying with Exhibit B. Washington County WJPA AM FM radio system 24, $6,980 were spent, $8,020 were committed. Recommended.
Any question on Washington County? So with Washington County, you'll note there were a lot of programs. We did send a lot back for more consideration. Washington County was one of those counties, and it's perfectly fine. They went out with requests for proposals as to how people, as to groups that might have wanted money to spend money or commit money to. And when they initially made their report on March 15th, they did not provide any kind of detail as to how the money was going to be spent or was spent. I would like to remind all of the counties that it ultimately is the job of the commissioners or those that commissioners delegate to come up, fill out these forms and provide us with the information we need. Merely giving us information coming from a person who may have made a request for proposal generally is not enough. That does require the further information, but the credit of Washington County, once we sent it back for further information, we received the information that was needed on all of the many programs that we just reviewed. Next, we're going to move on to Ben Salem Township. Before we do, you're going to note here, we've approved a lot of these going forward. They were all ones that had dealt with the counties. The counties have now been submitting information to us for 4 reporting periods and pretty much have the gist of what we want. And when we go back for further information, they have a pretty good idea. We said at the very beginning, when the trust was formed, we're going to learn a lot as we go along. And indeed, we all have, both the counties that are reporting and in our review. We are now getting on to townships and well, basically litigating subdivisions, including DAs. And you will see that there are more that we are going to recommend as non-compliant. In part, I think it's because this is the litigating subdivision's first time through this stuff. And I hope that going forward, they, as the counties did, will learn the kind of information we're looking for and the kind of programs that we are willing to spend money on. So, are willing to authorize them spending money on. So with that, we will move on to Ben Salem Township. That is group number 3. Shay.
Ben Salem Township Program number 3, the Ben Salem Department of Public Safety, Police Athletic League. They have spent $10,000. We are recommending it be non-compliant as the program does not appear to have a clearly established connection to OUD as a remediation strategy as outlined in the video.
Thank you. Berks County. That's also group number 3, Shay.
Berks County District Attorney,
District Attorney, excuse me.
program number 2, Task Intervention Toxicology Center. They've spent $52,246.29. We recommended non-compliant. Drug testing conducted through a probation or parole office is considered a law enforcement activity and is therefore not allowable under exhibit.
Okay. That takes us up to Bristol Township, group number 3, once again, Shay.
Bristol Township Program number 1 through the Bristol Township Police Department for co-responders. They have committed $67,116.05, and we did recommend approval.
Okay. That will take us to the Bucks County District Attorney with 2 programs, and once again, it is Shay.
Bucks County District Attorney Program number 1 through the Bucks County District Attorney's Office. Forensic Involved Diversionary Programs District Attorney. They have spent $177,053.84. How do you want me to separate that out? Because we're recommending the partial approval.
Just recommend, but it's a case like this where you're gonna have a recommended for partial approval, give the amount that we are approving.
Okay. We are recommending approval on the $177,000 and $53.84. That portion of funds is allocated to the drug diversion administrative aid and are in the opinion of working group 3 permissible under exhibit. The amount disapproved is $210,000, $210,066.63. Portion of opioid settlement funds allocated to assistant district attorney appear to be used for law enforcement purposes and as such are recommended as not compliant.
Any questions on program number 1 from the Bucks County DA? That will move us on to program number 2 for the Bucks County DA.
So similar situation here, Bucks County DA Program number 2, Bucks County Public Defender's Office, Forensic Involved Diversionary Programs, Public Defender. The amount, we are recommending a partial approval in the amount of $188,560.02. That portion of funds is allocated to the Drug Diversion Legal Secretary and are in the opinion of the working group permissible under exhibit E. The amount not recommended is $204,809.17, as this portion was allocated to the Assistant Public Defender. Recommended non-compliant as the services of an Assistant Public Defender are required to be provided by the counties and would not be considered an abatement strategy.
Okay, any questions regarding that? Okay, I will have a vote on the ones that, I'm sorry, City of Lockhaven.
State Lock Haven, program number 4, safe green spaces and learning environment, $46,915.29 is set inside. It is recommended for non-compliant. This program does not appear to have a clearly established connection to OUD as a remediation strategy, as outlined in Exhibit E. Does not appear to sufficiently related to the OUD expansion or treatment.
Okay, thank you. Any questions? Yeah, we'd like to ask for a resolution regarding the ones we've just reviewed. Resolve that the Board of Trustees of the Trust, based on the recommendations of the working groups that met and reviewed the follow-up report, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E. And by the way, it's the follow-up reports that we received from the counties, and also in this instance, certain litigating subdivisions, including DAs. That would be Warren County Program number 2, Washington County Programs number 2 through 15, and 17 through 24, Bristol Township Program number 1, Bucks County District Attorney Programs number 1 and 2, and I would note that that is a partial approval as described by Shay. And as part of the next resolution, we'll deal with the part that we disapprove. So can I have a motion to that effect? So second. Second. So motion and a second. Are there any abstentions before I go on?
Mr. Chairman, this is Senator Kiefer. I'd like to abstain.
Senator, would you like the minutes to reflect that you're abstaining from all of these resolutions or just, okay,
Thank you. I just was not able to get through all of those. Thank you.
understood.
Thank you. Okay, any questions? All those in favor of the motion, please say aye.
Aye.
Opposed? Any abstentions? Okay, that will take us to the next resolution. I'd like to ask for a resolution that resolved that the Board of Trustees of the Trust, based upon the recommendations of the working groups, hereby disapproves the following programs as non-compliant with the applicable terms as set forth in Exhibit E. And Salem Township Program number 3, Berks County District Attorney Program number 2, and the City of Lock Haven Program number 4. Also, those portions of Bucks County District Attorney Programs 1 and 2 that were reviewed and were noted were disapproved by the working group. Can I have a motion to that effect, please?
So moved, Kevin Boozle.
Thank you. Second?
Second Postal.
Thank you, Rob. Any questions? Any discussion? All those in favor, please say aye.
Aye.
Opposed? Okay.
We'll note Senator Kiefer's abstention.
Yes. Okay, that will move us on to Clearfield County, DA, working group number 3, Shay.
Clearfield County District Attorney Program number 4 with Clear's Spark Youth Educational Program. Amount spent was $813. We recommend approval.
Okay, any questions? Albany County DA, working group number 2.
Dauphin County DA program number 1. The Dauphin County District
Working group number 2, excuse me.
Yeah, that's good. Everybody's just. Dauphin County District Attorney's Office. This is for treatment courts, drug court, vet court, and levy court. This is in 2 blocks of approval. The portion of the funds that were allocated to a behavioral health unit program specialist are, in the opinion of the working group, permissible under Exhibit E. That was for a total of $78,891.20. And we recommend approval for that amount. The portion of the settlement funds allocated to the remainder of the program, which was $119,000, remains under consideration. Recommend.
Okay. Thank you. Moving on to Delaware County DA, program number 1, working group number 2, Stuart.
Delaware County DA, American Treatment Network for an opioid crisis response center. Total spent was $791,965.40. Recommend approval. Delaware County DA number 2, American Treatment Network for Community Recovery Center. Total spent was $62,675.24. Recommend approval.
Okay. Any questions? Northampton County DA.
Northampton County DA project number 1, Northampton SCA program Fake is Real, $199,972.38 spent. It is recommended for approval.
Any questions? Moves on to the city of Pittsburgh, their program number 1. Working group number 3, Shay.
Pittsburgh City, program number 1, Office of Community Health and Safety, and Office of the City of Pittsburgh for lead law enforcement assistant diversion program. The amount spent is $183,386.55 with an additional $29,870 committed. We would recommend approval. Pittsburgh City, program number 2, also Office of Community Health and Safety, Office of the City of Pittsburgh, reaching out to the streets for groups. Amount spent was $19,826.93, and we would recommend approval.
Okay, any questions regarding the city of Pittsburgh? Hearing none, we will move on to SEPTA, which was working group number 1. Stuart, or Kevin.
SEPTA project number 1, SEPTA outreach program called Scope, has expended $216.33. It is also recommended for approval, and I gotta tell you, that's one of the ones that kind of impressed me in the program. Being a SEPTA or being a transit, I was thinking, how would they spend that money? I just want to show a little favor to them because they did a nice job at they're doing it.
And I would concur with that. We were all wondering how a transit system would spend the money, but we feel they made very good use of the funds in full compliance with Exhibit E. Moving on to Warminster Township, working group number 3, Shay.
Warminster Township, program number 2 through the Warminster Township, MAT education for police and firefighters. Amount spent was $9,600 with an additional $25,000 committed. We recommend non-compliant. A response to the request for additional information was not provided, therefore compliance with the Exhibit E could not be determined.
Thank you. And finally, Wyoming Borough, that was working group number 2, Stuart.
Wyoming Borough, program number 1, Wyoming Area Regional Police Department for a dialed action program. Total spent was $9,574.64, and we recommend approval.
And that is it is not for police itself, it is for a prevention program with them working hand in hand with the Wyoming area school district.
Yep.
Okay, this will be our final set of resolutions. We'd like to ask for a resolution resolved that the Board of Trustees of the Trust, based on recommendations of the working groups, reviewed the follow-up reports from litigating subdivisions and hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E. That would be Clearfield County District Attorney Program number 4. This Dauphin County District Attorney Program, and we're asking for partial approval of that as outlined by the presentation. Delaware County District Attorney Programs number 1 and 2. Northampton County District Attorney Program number 1. Pittsburgh City Programs number 1 and 2. SEPTA Program number 1. Wyoming Borough Program number 1. I have a motion to that effect, please. Moved by the secretary, any second?
I'll second.
Second, any discussion? Other than the continuing abstention by the senator, is there I'd like to ask all in favor, please say aye.
Aye.
Sorry, Stuart.
I need to abstain from Pittsburgh City.
Okay. Stuart is abstaining from Pittsburgh City. Okay, all in favor, please say aye.
Aye.
Opposed? Okay, motion passes. And further resolved, I'd like a motion to this effect, further resolved that the Board of Trustees of the Trust, based upon the recommendations of the working groups, hereby disapproves the following programs as non-compliant with the applicable settlement terms as set forth in Exhibit E. Warminster Township Program number 2. Can I have a motion to that effect, please?
So move postal.
Rob? Second,
Like for a second.
okay. Any discussions? All those in favor, please say aye.
Aye.
Opposed? Motion passes. Okay, that is all of the programs that we are voting on. I just want to make a note because I've heard criticisms that we have turned down too many programs, that we are being too tight, too strict a reading of Exhibit E, not counting the ones that we dealt with today, most of which I think you'll realize were all recommended after sending it down for further consideration. For the first three reporting periods, there were a total of, when you include both litigating and non-litigating subdivisions, there were a total of 770 programs that were approved. There were only 24 that were deemed to be non-compliant. By any calculation, that's about 97%. So I think that when the proper information is submitted, as shown by what we did today, and it's been shown by our past record, the counties are learning that what the money can be spent on. I think that we've improved our communication process as to what we expect, but all said and done, when the proper reporting is done, and we have considered these, the bulk of the programs that are submitted by the counties are being approved. So I just think it's important to note that. Okay. You go, other questions before we go on? Yeah. Take us to the resolution regarding the September 1st, 2025 notice of estimated distributions. I would note that we are required by the Commonwealth Court order to submit by September 1st of each year to the counties and to the litigating subdivisions the notice of what we expect will be distributed in December of the year. It's just that it is an estimate. It is, I believe it will be accurate to about 90%. But additional monies can come in, and it's possible that some money we're expecting could be withheld, although I think Lisa will confirm that most of it now is in hand and probably will not happen. So what is going to be before you is going to be a resolution to approve the notice of estimated distributions. That notice is included within the materials that were submitted to you. But I would like for Lisa, who's worked long and hard on this, to explain the process you went through and what this represents.
So the estimates are made available to you in your packet. It's a spreadsheet titled 2025 September 1 notice spreadsheet. So if you want to follow along, that's the document that you would reference in your materials. We're going to distribute or plan to distribute about $103 million. There are distributions called Wave 1, and the companies involved are J&J and the distributors. It's a group of companies. And distributions that we're calling from Wave 2, that's Teva, Allergan, CVS, Walmart, and Walgreens. And we're making a distribution from a company called Endo. They have paid in everything they will owe, so that's a one-time distribution in these totals. There are multiple tabs in the spreadsheet provided. There is a summary tab. The summary tab includes all the estimated distributions for each county and subdivision, including if bellwether payments were to be paid. So the grand total, the bolded amounts, are the totals of Wave 1, Wave 2, of all the payments that we will make in December. This is the 5th payment for Wave 1. So if you're looking at supporting schedules, the numbers you're looking at, you want to go down to the column that says payment 5. Wave 2 is a little bit different. We made 2 payments together last year.
So this is payment 3, even though it's only the second time we're making a distribution. So if you look at the support, all the other tabs attached, you need to look at that third payment. All funds have been included that we are expecting to receive, although most has been received and available for distribution in December. There'll likely be some minor changes to the amounts that are finally distributed. For Wave 2 and distributors, some amounts were held in escrow. Same thing happened for Wave 2 last year. The calculation is in the details. If you want to see the amounts, they're available to you. When the trust receives those escrowed monies, they will be paid out. The Commonwealth will be paid in June, so the Commonwealth totals are not part of these calculations today. Happy to take any questions anybody has about the calculations if you've looked at them.
Any questions concerning the distributions? You will note that it's the reasons that were mentioned by Lisa is considerably less than the amount that was distributed last year. Last year, I believe we distributed in December 246 million. I would also note that for people that are trying to figure out if all that money has been spent, the counties litigating subdivisions are not required to spend that money that was spent, 246 million, are not required to spend that until June of 2026. So even the next couple of reporting periods, it might pick up some of that money, some of which was spent, but it might not include it. So our numbers are never going to jive with if you're looking at how much money was spent and how much money we're approving. But I did just want to point that out. So back to this particular September 1st notice. Any questions of Lisa or Andrew, any wondering why monies were escrowed or why it's an approximate amount? Hearing none, I'd like to ask for a resolution to authorize the numbers that were just reviewed. I'd like to ask for a motion that resolve the Board of Trustees hereby authorize Mara Dussel to finalize and the County Commissioners Association of Pennsylvania as a distributor of the trust to timely distribute the September 1st, 2025 notice to all participating subdivisions in a form substantially similar to that provided to the trustees in advance of this meeting. If any adjustments to the estimated distributions become necessary, Mara Dussel is authorized to make such adjustment prior to the distribution of the notice to participating subdivisions. I have a motion to that effect, please.
So move.
Second,
Second.
any questions? All those in favor, please say aye.
Aye.
Opposed? Motion passes.
Chair, can I just make a point? In addition to the September 1 notice going out to participating subdivisions, once that happens, it will also be posted on the trust's website, which is what we've done in the past. So the public will have access to it through that mechanism.
Thank you. For clarification, so thank you. Okay, that will move us on to the next agenda item, which is the annual report to the Commonwealth Court. We are required to make an annual report according to the opioid trust order that was entered by the Commonwealth Court. We made the determination because we were first formed in July of 2022 that we would have the first annual report cover the period from July of 2022 to June 30th of 2023. And that report was filed. We then decided to keep it on that kind of a fiscal year basis so that the second report was filed last year, which covered the period for July 1, 2023 to June 30th of 2024. What is contained in your packet is the report that is the report covering the period July 1 of 2024 through June 30th of 2025. You will note in the report, if you when you reviewed it, we did pick up when there were changes in the makeup of the trust due to new trustees being named, such as Representative Fleck was named during that year. They are mentioned to the extent that we have two new commissioner or trustees that were just named within the last week or so. They will not be included in this report. They will be picked up in the report that will be filed next year. So if everybody had a chance to review the third annual report, and I'd like to have anybody point out any changes they would like to suggest or any questions they have about the report. It was prepared by counsel. I can assure I did not do all that writing. Discussion? Okay. Case, I would like to ask for a resolution that resolve the Board of Trustees hereby authorizes Ken Ingersoll and Rooney as counsel for the trust to file the third annual report with the Commonwealth Court of Pennsylvania in a form substantially similar to the draft included in the materials for this meeting. Could I have a motion to that effect, please?
So moved. Haven't used them.
Okay, second.
Second, Alexander.
Thank you, Tamar. Any discussion?
I do want to say there's a wealth of knowledge in there about how these programs are. I mean, I even though I'm here, it's a nice review, so I would really encourage.
It is, as Kevin pointed out, this is a very thorough review of everything we did. What is filed with the Commonwealth Court is a matter of public record. It is on the docket of the Commonwealth Court, so that it is the public can review it at any time. Anybody can review it at any time. So I would suggest if you have questions, first turn to that and see whether or not that answers questions you may have.
And the report will be posted on the trust website as well, even easier to get there after it's filed.
Yes. As are the prior reports.
Correct.
Okay, any further discussion of the motion? Can I get a motion in a second?
Yes.
Okay. All those in favor, please say aye.
Aye.
Okay, motion passes. I think, is there any new business to come before the group? And then I do have a statement about what's going to follow this meeting. So is there any new business to come before the group? Okay, hearing none, accept the motion to adjourn. And we are going to adjourn the public meeting now and move on, break for now be about an hour and 10 minutes. Reconvene at 1 o'clock for a public listening session. And the purpose of that session is to have members of the public that signed on. We discussed at our last meeting, there would be a sign-on process. And a number of people did sign on to speak to the group. We are not going to be having it as an open discussion. The public, the people that signed up can speak. We appreciate your input. We do not intend to answer any of the questions that may be posed today. Although if there are questions that are posed in the comments, we will be happy to get back to you, and the trust will meet to decide how to go about that. I do want it to be a response from the entire trust, not just from one or two individuals. We did have about 17 people sign up, but We also had a follow-up where people had to confirm that they were going to be appearing. Only 10 people of the 17 responded, so we are going to hear from the 10 people that responded and hear the public comment. We ask that the people who are commenting keep their comments to a 5-minute period of time. As was set forth before, and we will call on people in the order in which they, I think, basically as they signed up. Is that correct, Bree?
In the order in which they signed up?
Yeah.
That's correct.
Yeah, it's in the order they signed up, with one exception, that one young lady has a prior commitment at 1 o'clock and asked if she could be put at the end of the list, so we're going to accommodate that. So we will reconvene. Everybody can get off the phone now. I do ask that all trustees that are on this call, please get back on. This is a very important session. It is one we promised the public that they could have at our last meeting. And I think it will be a very worthwhile listening session. So I encourage all of the trustees to back on and hear what I am sure will be very interesting remarks. So meeting is adjourned for now, and we will reconvene at 1 o'clock for the listening session. Thank you.